I'm Dr. Fakir Avari, and this is Clinical Microlearning. Here's a self-assessment question. A 40-year-old woman is suspected to have a bacterial infection. If the healthcare team wishes to start her on empiric antimicrobial therapy, which option represents the most ideal timing? A. Wait until rapid diagnostic test results come in. B. Initiate immediately after receiving susceptibility results. C. Begin the therapy after the organism is identified. D. Start the therapy as soon as possible after specimen collection. Please pause this video and think about the correct answer. The correct answer is D. Start the therapy as soon as possible after specimen collection. The reason choice A is incorrect is because we don't want to unnecessarily delay antibiotic treatment. By waiting, it will take some time for rapid diagnostic test results become available. If we initiate immediately after receiving susceptibility results, that's also unnecessarily delaying antimicrobial therapy because it will take a few days for susceptibility results to come back. And C is incorrect because it also delays antimicrobial therapy if we wait for actual identification, which will take about a couple of days. So here's what will happen. So when a patient is admitted to the hospital, specimens are collected, and these specimens will actually need to be placed into an automated culture system or something similar for bacteria to have nutrients and the right conditions to grow. And then if growth is seen in these specimens, then the next step is to actually either send this to rapid diagnostics if available, and at the same time essentially stain them and look at the gram stain or other stains depending on what has been suspected, and the morphology will be available. This will typically take about 1 hour, but by the time the gram stain and rapid diagnostics are available, this is typically at 1 day, so it takes about 24 hours for all of these to come in. And then it will take another day or two for actual identification of the organism based on traditional macro lab tests, and then another day or two for the actual susceptibility results. Now, it is important to give empiric antibiotic therapy, ideally after the specimen is collected, to make sure that the yield of identifying an organism is not compromised. But that we do not want to unnecessarily delay empiric treatment. Here's another self-assessment question. An elderly patient in the ICU has a suspected bacterial infection. The clinical team is not only interested in rapidly identifying the bacteria, but also wishes to obtain MIC values for select antimicrobials to better tailor the treatment. Which diagnostic test will meet both these requirements? A. Quick fish. B. Biofire film array BCID2. C. Accelerate phenotest BC. Or D. T2 bacteria. Please pause this video and think about the correct answer. The correct answer is C. Accelerate phenotest BC. And essentially, while choice A and C use the same technology, essentially Quick Fish can identify the organisms but is unable to give MIC values. Accelerated phenotest is a relatively newer test that uses the same technology but is actually able to report MIC for select organisms, so not for every organism out there. Now, when it comes to choice B, is actually essentially can detect the presence of resistant genes, but it will not be able to give MIC values. And with choice D, essentially an organism can be identified, but MIC values will not be available. So multiplex PCR, there are several different tests on the market, and these are essentially tests that can very quickly detect select organisms. So if an organism is on this list, and select resistant genes can be detected. Now, if there's something outside of this list, it will not be detected. So we still need traditional microlab. And then, we have some other technologies. So pinnafish and NMR and PCR combined. So T2 bacteria will not give you resistance, whereas X-ray phenotest will give MIC values for select antimicrobials, and it will take about 7 hours. Here's another self-assessment question. A 45-year-old woman presents with signs of sepsis. The healthcare team draws a blood sample and is looking for a diagnostic test that can detect bacteria directly from whole blood without waiting for bacterial growth on an automated culture system. Which diagnostic test would best fit this requirement? A, MALDI-TOF, B, multiplex PCR, C, pinnafish, or D, NMR and PCR such as T2 bacteria. Please pause this video and think about the correct answer. The correct answer is D, T2 bacteria. This is a test that can actually identify organism directly from whole blood without requiring actual growth of the organism. If you like this micro moment, make sure to subscribe and like this video.